Namaste and welcome to Nepal Conversations. Nepal Conversation is a podcast series where we talk to scholars and researchers about the interesting work on various aspects of Nepal. We ask them to reflect on old and new problems, challenges, and possibilities confronting contemporary Nepali society. The theme for Nepal Conversations' second season is gender. We will present a series of conversations on the topic of gender and sexuality and what it means for Nepal.
Our guest today is Dr. Paul Boyce. Paul is a reader in Anthropology and Sexuality Studies in the School of Global Studies at the University of Sussex. His research focuses on sexual and gendered subjectivities, seeking to relate theory to practice. He did his doctoral research in West Bengal, India, where he explored same-sex sexualities and transgender experience in relation to social change and modernity, and in contrast to the representation of sexuality in HIV prevention discourses and practices in the 1990s. During this time, he also carried out the first study on male same-sex sexualities in Nepal in collaboration with what was emerging to be the first LGBT organization in the country, the Blue Diamond Society. And he subsequently went on to publish further important work on sexual and gendered subjectivities there. Paul's research critically explores conceptual absences in anthropological approaches to sexualities and considers the heteronormative implications of such absences. He also continues to carry out applied work in policy and program development internationally.
Welcome to Nepal Conversations, Paul. We're really very happy to have you today with us. You work at the interface of anthropological research and you've been working on theorizing sexual and gendered subjectivities. Especially you focused on West Bengal, but also carried out very important work in Nepal. Could you tell us a little bit about your work in general and especially in relation to Nepal?
Sure. Yeah, thanks for inviting me. It's really nice to be here. So my work really explores ways in which people's experiences of gender and sexuality as sometimes perhaps as forms of subjectivity or sometimes as forms of experience or ways of being, which may not land or be experienced in people's sense of self as a formally identified subjectivity, but which might be somehow more amorphous, less named, less obvious, less specifically categorized. These ways of being really interest me, things which are maybe elusive to representation easily in language or representation easily in policy or law or health promotion. So those tensions between forms of action and forms of research which somehow want to name and label and frame the sexual and genders versus the things that they leave out, the things that research processes leave out, the ways of being which are sort of marginal to those optics is something that's really interested me. And that really began initially when I was working in West Bengal. I came to work in West Bengal having been working in community-based HIV prevention in the UK, and I had the opportunity, which is a long backstory, to go and do similar work in West Bengal in Nepal, which led to me living and working there for a few years on some of the early community-based sexualities, HIV prevention work there. It was framed around the kind of global health category MSM at that point, although that kind of, you could see that gradually emerging into kind of other kinds of categories that became to used in those kind of contexts. And I was very interested immediately when I look back on those days and how research parameters help to frame and categorize ideas of sexuality and gender, but also lots of things could never be told very easily in those different kinds of research parameters that I was concerned with. Some of the research parameters that I was concerned with were very kind of global health promotion oriented. Some of them were sexuality studies oriented. Some of them were sort of more anthropological oriented. I was interested in the different kind of stories, the different kind of perspectives that could be framed in those contexts. And then whilst working in West Bengal, I came to know the project that I was working in was funded by something called the West Bengal Sexual Health Project. And the interim director of that project lived in Kathmandu. And he was sort of down from Kathmandu helping to set up this project. And I came to know him. I visited Kathmandu a few times, and I was asked through him, his name was Paul Janssen, I was asked through him to meet with an organization that was interested in funding some early, I think they were called process documentation, sort of formative research around same-sex sexual experiences, gender diversity, and the beginning of a sort of a research agenda and a program agenda for HIV prevention with such people in Nepal. So I became involved in the initial funding bid for that piece of research, and that led to me working in some of the very early projects.
Thanks very much, Paul. I want to go back to your interest in elusive representations of gender and sexuality in language, policy, or law that you talked about just now. And I want to take you back to the first study that you did in Nepal in 2001, which was an ethnographic study on male-to-male sexuality and the category of MSM that you mentioned, men who have sex with men. So you carried out this study in collaboration with Sunil Babu Pant and some of the first queer activists in Nepal. I just use the term queer loosely.
Oh.
And in that study, you talk of the Blue Diamond Society as a nascent organization. And I found your study provides a rich context of what it was like to first mobilize as queer activists in Nepal in the late 1990s and early 2000s. Can you tell us more about this time, please?
Sure, I can. So when I would have gone there, it would have been, I think, 2000, maybe 1999. So at that time, this was a time when there was a sort of growing public health interest internationally in working with community-based organizations for HIV prevention. And at that time, the category MSM, as it were of particular interest because they were seen to be kind of particularly vulnerable to the transmission of HIV, or particularly important people to work with in terms of epidemiological control. I think within that category of MSM, it certainly became very obvious to activists very quickly that there were all sorts of other gendered and sexuality ways of being which were certainly not easily categorizable as male, and often definitely not. So I think the MSM project soon promoted various kinds of other ways of organizing and being, sort of nascent Meti, Koti, transgender kind of projects emerged out of the MSM paradigm, and partly in resistance to them. And in Nepal, when I came to be involved in that work, it was funded by an organization which was called Family Health International. I think it's called now FHI 360. So they had an office in Kathmandu, and they were part of one of the international funders who wanted to fund this kind of community-based intervention. And so they were looking around for people in Kathmandu who could help to bring that about. And because I've been doing similar work in West Bengal for various reasons, which, to be honest, I don't really understand or know of, I was asked to be a research consultant to that project and to help to formulate it. At that time, the Blue Diamond Society didn't exist. When I say it was nascent, I would say it came into being at the time that I was there. So Sunil Babu Pant had, if I remember correctly, and I don't want to speak for Sunil, but if I remember correctly, had just arrived back from Belarus, where he'd been studying. And I came to be introduced to him at that time when I went to do that project. And he was interested in beginning to formulate what a community-based organization around these issues would look like, and how it might function, how it might be funded, and so on. So the kind of research process that we were going to be involved in would be the first grant that would support that kind of work and would support that kind of community-based organization. So if I remember correctly, I think it required the formation of a community-based organization who could then be the formal recipient of the grant. And it was out of that catalyst that the Blue Diamond Society then came to be formulated. I remember walking over a bridge in central Kathmandu with Sunil, and him saying to me, I've decided to call the organization the Blue Diamond Society. And so it didn't exist. That was when it was coming into being. So I was there at the moment of that organization coming into being.
Thanks so much for sharing this research journey and also for this really important work that you've been doing. As you mentioned, the early 1990s and 2000s were like early days for queer activism in South Asia, and especially in Nepal. What were the challenges and opportunities for queer activism during this time?
I think some of the opportunities came from the global funding interest that was around at that time. So it was supporting community-based organizations. So there was capital, there was a flow of money. I mean, not huge amounts of money, but money which could help to set up an organization like the Blue Diamond Society, help to employ community-based outreach workers, help to give a focus and impetus to the work. That was also, I would say, an issue in that it sort of, in a way, framed the optic through which such people might become involved as civil society actors, purely through health-based issues, and specifically, I suppose, through HIV. I mean, that was an opportunity, of course, but it meant that I think it's the ways in which other kinds of sexualities, praxis, or activism might have taken shape were somewhat overwhelmed by HIV, and that being the prevailing funding paradigm. I mean, it was an urgent need to respond to the epidemic. You can sort of see why it happened, but it also seeded, I think, lots of problems which came later around anchoring so much of that work to global health practice and not allowing enough diversification of organizations to function and flourish. I think in terms of the immediate challenges of doing work as we were asked to do in Kathmandu, there were the challenges of helping, for me as a kind of research consultant, to frame the idea that the research should be done by the community, should be done by, if I can say, sexual and gender minority people themselves, however identified or not identified. When we first began the project in Kathmandu, that first project, which pertains to the report that you're referring to, we were hooked up with an external research-based organization, the name of which I cannot remember, who were going to conduct the research much more from kind of an external point of view. They had all the kind of right global health type language and MSM kind of frameworks in place. But it seemed to me that this was a very top-down external method, which was then framing the people that we were going to be working with as the subjects of interest, or the objects of interest, as it were. And my perspective was that we ought not to approach that way, that really the community members ought to be employed as the researchers. They had the close perspective, they had the emerging understanding of what the issues were. They could, with some research training, they would then be able to conduct the field work themselves. So that's what I argued for, and that's the way that we went. So we then didn't work with that external organization. We developed a training package. Sunil and I developed a training package for community members who in sort of basic research skills that we then put into practice to sort of produce the kinds of data that we were asked to come up with. It's interesting that you call that an ethnographic study. I don't know if I would have called it that. In some ways, there was a duality to that work. In some ways, there was the doing of the research that the funders asked us to do, which was much more directive and proposive, asking us to sort of come up with some rough estimates of what the issues facing MSM were in that context at that time. And there was also the kind of standing back perspective that I had on it, or others might have had on it, looking at us doing the work and thinking, okay, so what does this signify about how sexual and gender diverse people are being co-opted into research processes? What opportunities is that creating? What limitations is that imposing? So I had all those kind of questions going on as well at the same time. They might not have been questions that were discussed formally in the documentation, but I think they've been very informative ever since, certainly for me.
Thanks, Paul. Can you say a bit about the opportunities and limitations that you were thinking about then?
Well, I think the opportunities were that you could see, and this is not unique to Nepal, there's similar things happening in India and other country contexts, that in a way the funding that came with HIV brought along with it a kind of, for some, and certainly not for all, but for some, a kind of enfranchisement where they could become seen as respected employees within a kind of formal health promotion context, where their community organizing had the kind of the authority of being important to health and health promotion research associated with it. So it granted a kind of legitimacy to people who otherwise had experienced their gender and sexualness as, in a way, always just kind of a stigma or very negatively. And that's not to say that the kind of things that came along with HIV and the work opportunities that came with that didn't erase all of those things. It certainly didn't, but it provided a certain kind of opportunity for some people who were associated with some organizations to acquire a certain kind of professional status that they would not have had otherwise. Now, the limitations with that was certainly at that time, and really for quite a long time afterwards, that was mostly a kind of cosmopolitan-based series of actions. So, more rural or peri-urban queers, if we can say that, were not so well co-opted into those movements. Although I think in Nepal over time there was an expansion, certainly, of organizations into those areas. And I think it also anchored a lot of those community infrastructures to HIV funding. And now, whereas in recent years, a lot of that funding for community-based organizations through international HIV funding has been has all been moved away to kind of more biomedical forms of action. I think a lot of organizations have been left somewhat high and dry, and found themselves floundering, for lack of funds.
I had a follow-up from the previous discussion that we were having. I was wondering, because you said categories like Métis and Koti emerged partly in resistance to the MSM category. So for our listeners, could you say more on this?
Sure. So I think it was very early on, well, reasonably early on in HIV work, that various activists began to really problematize the acronym MSM. I've written something about this recently, came out a couple of years ago. And there are various problems with that acronym, but one of the things is in the context of work in South Asia, it was often used to describe a range or labeled or lumped together a range of gendered ways of being or identifying which weren't male, So a lot of the people who were coming along to some of the early kind of MSM type projects, for example, going back to Calcutta, weren't male self-identified, and so we're sort of casting around for other ways of thinking and begin to think about setting up organizations, maybe also within the umbrella of HIV prevention funding, but which would make forms of visibility otherwise. So terms like Koti, which has various kinds of meaning, but might be ascribed as a kind of a feminine subject position, sometimes lived and experienced by people who might otherwise sort of in other contexts present themselves as normatively male, or in other contexts might be seen as a kind of proxy for a transgender position. It's not something which sort of fits into the kind of neat kind of westernized categorizing logics that we might otherwise want people to, in inverted commas, fit into. One of the very first Coty type organizations called Protoi came out of the organization that I was working in Calcutta in the late 1990s. And I remember being around at that time and talking with the two main activists who were formulating and framing what that organization could look like at that time. So initially it existed within the umbrella of the kind of typical MSM type project that I was working in. And then Protoi existed as a kind of almost like a but autonomous sub-project within the framework of that project before going on to acquire its own identity and its own funding, its own separate organizing, and then various other kind of similar projects came up out of that, both in Calcutta and in other parts of West Bengal. Now, when I went to Kathmandu in, say, 2000, I could see a very similar kind of thing happening. I remember speaking with Sunil Punt about it, where the ways in which the term Meti was being formed and appropriated into a kind of research / activist discourse as a kind of as a cultural indigenous terminology to figure a kind of, I know, a gender queer, I mean, we didn't use that language then, but sort of gender queer subject position or gender queer object of interest for HIV prevention, which was not male, but was expressing gender in different kinds of ways. And the Meti became to be seen as an important category, or was coming to be seen as an important category at that time. Now, it's kind of interesting to have that conversation, though, to see that it was very similar to the way in which the local, in inverted commas, Coty category in West Bengal, India, was emerging as somehow both local and newly invented. At the same time, I think that was happening with Meti, that Meti was being presented as a kind of always there, always already kind of indigenous cultural category of gender and sexual difference. And at the same time, it also seemed it was being fixated on and reified and made up out of the need or the perceived need of community-based HIV prevention funding to have local subjects at whom to direct attention.
Thanks, Paul. I think these histories are so important for us to remember or to know about and reflect on. So when we're talking about language and self-identification, one of the contested issues within queer organizing in Nepal has been around identity categories like LGBTI, which are more global, and identification with other vernacular categories. So the discussions have sometimes been, often since the beginning, have been centered around, among other things, what categories to use and what not to use, what the categories mean, and so on. But in one of your papers from 2013, you talk about how people's self-identifications with categories cannot be taken as permanent or fixed, and that it should be understood within a relative context. What do you mean by this?
Sure. I mean, and in there, I'm sort of really drawing on anthropological and gender studies perspectives, which sort of open out ways of thinking about gendered self-experiencing or gendered forms of personhood as beyond the gendered body, right? So gendering takes shape across a range of relational and contextual interactions, which are not just then innate within bodily selves, but which are produced through various interactions and artifacts and ways of being. So, say, for example, then taking up the idea of the Meti again as a kind of gendered subjectivity, I was very interested in how that subject position was produced. It might be authentically felt, it might be true to somebody's experience, but the capacity to think or feel of oneself as that being the authentic signifier of a kind of identity emerges in time, in context, in relation to various forms of interaction. So as various kind of documentations in a way produce the idea of the Meti as a category of interest, people might look at that and think, oh yeah, that's me. And they might then feel or come to be that subject category. It's not such a kind of literal process, but it's rather perhaps a kind of hybrid of the kind of felt sense of being in the world, the kind of linguistic frameworks which exist in Nepali, and the kind of imperatives of global health interaction and forms of documentation all coming to bear within a given moment in a given time to produce that gendered way of being as a possibility for self. I've argued similarly and probably in more depth in the same in respect of the Koti category in India, that it's in a way an effect of HIV prevention work which seeks the local, and then the local comes to identify itself after that framework. Now, it's not so literal, and it's not to say that there aren't in-depth Koti histories and lineages and ways of being, but my sense is that the idea of Koti as a form of identity, in a more kind of specific sense, came to be consolidated much more specifically in its interaction with HIV prevention work at that time. And in a way, it's a category which I think is you can see it flowing in and out of discourse, of public discourse. It's a category which I think is much less used in the public sphere now, where the language of transgender and so on has become much more an important part of the political and activist discourse in Nepal, and the category Koti still present, but it occupies a different kind of position, a somewhat waned position within the public sphere. I think probably also you'd seen in Nepal also transgender activism being much more kind of a feature, or queer activism being much more kind of a feature or discourse which is used in the public sphere now. Certainly that wasn't in presence when I was first working there in the 90s and the 2000s. People were not using queer as a kind of activist label at that time that I recall. Transgender people might have done, but at that time people were typically using the term meti somewhat more, I think.
Just to follow up on this paper, in this paper, as well as another one that you had published in 2015, you emphasized the need to apply a holistic method to the study of gender and sexuality. What would such a holistic method look like within research and also within development interventions?
Yeah, so I think it's somewhat after the lines that I've just been talking about. So instead of just taking subject categories as if they're just there and always already present, it's about looking at how these things emerge into discourse and emerge into public life, or emerge into intimate senses of selfhood in particular contexts, through particular interactions, through particular relational networks, for particular professional affiliations. So then you don't then just have your project which then has a tick box of sexuality or gender types, and you sort of say, okay, so there are X many metis in this given context, which might be seen as a kind of typical kind of global health kind of demographic way of doing things, but to rather understand these as discourses, as paradigms of selfhood, of paradigms of governmentality, as paradigms of epidemiological control, and as paradigms of political discourse. So that there aren't then any kind of intrinsic selves, as it were, at the heart of the research enterprise, but person who's understand as multiple, individuated, and fragmented. Now that is complicated if you're also then working with activists, because of course activists often are very wedded, and rightly so, to their identity positions or their subject positions, as are indeed people in everyday life, you know. So who are we as researchers then to come along and deconstruct those positions? And, you know, often people might feel that, well, that means that you're saying that my sense of self is not authentic or true, but it's me, it's how I identify, and that's up to me. So I think these are very sensitive issues that we as researchers have to be constantly attentive to. We often pulled in different directions as researchers. We have this kind of deconstructivist kind of approach and then we have all these kind of commitments to real world action, and they don't always meet very easily, but I think it's that tension is nonetheless a productive one for thinking with. And that might pertain to the holism that I was seeking to allude to. I think it was Daniel Coyle and I wrote that holding all of these things together, rather than just sort of fixating on sort of more sort of simplistic, individuated ways of categorizing people as our objects of research interest.
Thanks, Paul. I have been meaning to ask you this question for a while now. So you mentioned this tension between activist work and academic work. I have found that within my own work as well. But you also talk about how that tension could be a productive one. Could you say more on that?
Yes, I mean, I think it's productive in the sense that it really, as researchers, as from the kind of more academic standpoints that the three of us perhaps occupy, I think it requires us to think about our obligations and entitlements and requirements, and that we might want to go off into various forms of abstraction in our thinking, which I don't denigrate at all. I think that's very important. But then how might we bring that back to thinking with community organizers, for example, and thinking about the things which matter to them. Now, for me as a researcher, if I can just say my own experience, that means I've done a lot of things which I think probably from an external perspective might look very inconsistent. So I've done pieces of writing which are much more theoretical and abstract. I've done quite a lot of research reports where one is trying to find a different kind of language which is more accessible, perhaps less theoretically complex, entails a range of different compromises because it's not only your voice, it's not only your analytical voice that matters in that domain. So there's a lot of letting go, I think, involved in that kind of work. I think that was a very important lesson for me when I was doing and finishing my PhD, and I became involved in various forms of health-based research and advocacy and sexualities praxis in South Asia and then elsewhere at that time. I'm realizing quite quickly that although I had these range of kind of academically oriented perspectives on, for example, the construction of the coati as a subject in mind, that the people who were commissioning the more kind of applied health-based projects that I was employed to work on at that time weren't particularly very interested in that, and was within their paradigm. So I could bring that to the table and discuss that, but it was trying to find forms of language which would do a little bit of what I thought needed to be done, not just labeling people as if that's all you needed to know, but trying to pay attention to people's lived experience and trying to bring that kind of perspective into the more kind of applied based projects that I was employed as a consultant on. And then mediating that world with the world of community-based activists, which was often a position that I found myself in, which again was not straightforward because activists for the most part, and not at all in mercenary terms, but we're just most often just looking for funding, that's the real imperative for them. And so they were sort of looking again to frame their experience in ways which would be commensurate with what funders wanted to fund, So I was often find myself in that kind of intermediary position of trying to dialogue with different partners in processes where community organizations were being commissioned to undertake pieces of research and trying to find ways in which would be meaningful to all parties involved. I often sort of saw myself doing that. It's almost like a sort of damage control kind of thing, so that at least as good as possible could come out of those interactions. I'm not sure that I always was successful in those forms of mediation or action, but that's sort of how I conceptualized what I was doing to myself. I worked in various country contexts around the world for different development organizations for a while, as well as working as an academic. So I had that kind of hybrid perspective, so to speak.
You raise an important point for us as researchers about being involved in some ways, but also about letting go of some of the things, especially keeping in mind the different contexts within which we move as we are doing research, but also engaging with different communities. And I can only imagine what the activists might have to say about us as researchers. But to go back to the research methods that you've used, you've said that you, and as it is seen in your work as well, that you've worked with diverse groups of people, including local and more globally mobile activists and development and public health workers, scholars. And you've talked a bit about the research methods that you've used with different groups and how your approach might have changed over the years. But if we look at the diverse audiences that you've worked with, activists, but also policymakers, and so on, can you maybe say a bit more about how your approach has changed over the years, or how you have approached catering to the diverse audiences as a researcher that is also involved in activism?
Sure. So one thing that I've tried to do is use different methodological approaches at the same time. So I'm thinking of those reports that you mentioned, I think published in 2013 and 2015, based on work in Kathmandu. I think the first one especially was concerned with the legal context of in Nepal around gender and sexual diversity. So one of the things that we particularly wanted to look at in that context of that research, which was funded, I think, by the Department for International Development through a program funded at the Institute for Development Studies at Sussex, was to allow people to express themselves in different kind of way. I think by that time I'd become very preoccupied with the idea that often when you interview people, particularly in the context, it's different if you're sort of doing something over an extended period of time as an ethnographer, say in West Bengal, where I've lived and worked for many years. There's a difference in that, or certainly for me at that time, there's a difference in doing that as compared to something in Kathmandu, where certainly I was coming in, although I'd worked in Kathmandu and spent time in a fair bit of time in Nepal over years, I wasn't as connected to the city as others. So it's very important, I think, as a kind of researcher or research facilitator in that context, to try to, in a way, democratize the research process as much as possible, to pull oneself outside of the center of it and to allow multiple voices to become better heard. So one of the ways in which I thought to approach that was extending out of some work that Anindu Hajra and I had done in West Bengal a couple of years previously, was to use community-based visual research. So when we were doing the work on the legal context in Kathmandu, one of the things that we were very aware of, and which I think is still really commented on by activists now in Nepal, is that despite legal reform, and a decade on from when we were doing that research in 2013, still now, despite legal reform, the everyday life experiences of queer, trans, gender and sexual minority peoples in Nepal remains fraught with various kinds of prejudice or stigmatizing interaction. So we wanted to allow for people to express that in their experience. So we gave people basic point and shoot cameras and asked them to go out and photograph their experiences. And we asked them to photograph abstract things like stigma, pain, grief, pride, happiness, the state, the law, as it might be represented visually in their experience. So we had I'd say about 30 or 40 participants in that project, and it went on over a period of months. people were just going out, taking lots and lots of different photographs based on their own experience. And then we came together in the offices of the Blue Diamond Society to explore the photographs, so to see what forms of storytelling might surface through this visual methodology, which was not necessarily come out perhaps through a series of interviews or through an analysis of legal documents or policy documents. And it was very, very interesting in some different ways. One thing I learned in doing that was initially when we had the whole group assembled in the office, everybody presented their own set of photographs and told the story. And whilst that was interesting, it individuated everything too much. It consolidated everything around individual stories. So in the next workshop, we felt it was very important to break all that down. So we mixed all the photographs up on the table and asked people to respond to the photographs and knit them together in new kinds of ways, such that the individual story was lost and the more individual fragmented patchwork perspective began to emerge in the narrative. Now, for me, that was a very interesting exercise. It was very interesting in terms of a collaborative, community-based visual project which told the story in another way, but it was also a good way of getting beneath the positive discourse of Nepal as a kind of sexual rights Shangri-La, which I think activists still critique now. From an external perspective, you could paint Nepal as a kind of sexual rights success story, or gendered rights success story, which maybe in some ways it is, in terms of certainly some positive aspects of legal reform. They certainly wouldn't want to discount that. But even as activists in the last year are now campaigning to get rid of the category other in gender registration documents in Nepal, to nuance and diversify that, there's a long way to go. And I think it's very, very important to recognize that law doesn't solve the problems. You might have your legal rights, but so what if you don't have a good form of livelihood, or if you still face everyday discrimination, or if you're still ostracized from your family? So I think having methodologies which enable these multifaceted perspectives to interact and to begin to frame and open up diverse perspectives is one way in which I've tried to approach things.
Yeah, thank you. Absolutely. This visual method sounds very exciting and very important to understand, as you said, also to nuance and diversify the complex issues such as gender and sexuality. Thank you so much for sharing that with us. We have actually now come to the end of our conversation. But before we go, could you tell us a bit more about your new projects? What are you working on right now?
Yeah, so I have a few projects at the moment. So at the moment, I'm working on a retrospective piece of writing, which I think part of our conversation today will inform, looking at ways in which activism and global health work and queer life worlds all came together and came to be framed or formed or conceived of in the context of HIV prevention work in West Bengal and South Asia more widely over the last 25 years. So I'm sort of looking back on that. I've been working on this for a while, and it's sort of something which is stubbornly refusing to write itself, but I'm making a more concerted effort with that now. I'm based in the UK, and I'm doing work on section or sort of LGBTQI experiences of higher education in the United Kingdom, which has been one of the first, I think it's been the largest national survey to date on that project. More recently, I had some work also on experiences of gender and sexual minority, specifically transgender employment in India, with a case study in the northeast of India around Manipur, which was working with, there's been in India, there's been sort of fair bit of corporate level work on queer and gender diverse inclusion in the workplace, but much less in the kind of much larger mid-level employment sector. So we were working on that, taking Manipur as a case study. And I'm hoping this year that we can start to frame a larger scale funding bid for that project. But I think these are very challenging times for sexualities researchers. I think there's not much money in the system for all sorts of things. I think it's difficult for us to get large projects off the ground. I think we have to take care of ourselves as researchers as well, to manage our expectations in terms of what we can reasonably achieve. Kamud, I noticed that you mentioned earlier about what people might expect of us, what activists might expect of us, and we have to think about what we expect of ourselves as well, and what we can and cannot do. And I think sometimes sometimes I think I have expectations that I should be able to do a lot more than I can, yeah, most of the time I feel that I'm not doing a very good job of that. So it's I think I'm learning a lot about how to be as a researcher, what kind of professional identities to hold on to, and what to let go of. You know, I've been doing a lot of letting go, actually. I think with time, you might feel that you sort of add more layers to the constructs that you build, but I also think you take a lot away. You can take a lot away and think, yeah, I don't need that. I don't need to try to do that. I don't need to present myself in that kind of way. I don't increasingly feel less attached to a professional identity as a kind of anthropologist or a researcher or ethnographer. I feel that I want to complicate these in a way that I suppose I was talking about complicating ideas of gender and sexual selfhood. I also just want to let go of these ideas that researcher, anthropologist, queer theorist, or global health researcher, that these are also just categorical terms that can frame us in certain kind of ways, but we can also just let go of those. And what happens if we let go of those and try to approach our research outside of those categories of selfhood which other people might want to give to us? So I'm thinking about that a lot lately.
Thank you so much, Paul. This has been such a reflective and important conversation. Like you said, to think about what we expect of ourselves as researchers. I think that's what is going to stay with me. So we've talked about an important history of queer organizing in Nepal and your involvement in it, about the possibilities and limitations of identities, and about activist academic engagement. This has been very insightful for both of us as well. Thank you very much for coming to speak to us.
It's my pleasure, and you really helped me to think through those times and to think through a new understanding of those experiences. Thank you.